Great, thanks so much. Hi, everyone. I'm Shalini Raichur, Senior Policy Analyst for Health Equity at AHIP. Before I begin today, I'd like to thank the National Patient Advocate Foundation for inviting us to present this work, and a big shout out to the Patient Insight Institute for partnering with AHIP in conducting the research being presented today. Next slide, please. So we know that there are several factors that contribute to a patient's healthcare experience. For example, the demographic characteristics of a provider can impact the patient's perceptions of their care. Additionally, the physical and virtual healthcare environment can contribute to a patient's perspective on the care they receive. Interfacing with healthcare environments can include anything from proper implementation of gender identity, birth sex, correct name, or pronouns into electronic health records to accessible medical and diagnostic equipment necessary for routine medical care. Addressing factors that drive patient care experience is necessary to ensuring an equitable healthcare experience and positive health outcomes and overall well-being for patients. Research has examined patient-provider congruence, patient-perceived discrimination, and strategies to achieve health equity. However, little is known about patient-generated perspectives and preferences when it comes to equitable healthcare, including healthcare provider characteristics and qualities and the healthcare environment. This project sought to fill that gap by capturing patient perspectives on environmental and provider factors that drive equitable healthcare through survey development and qualitative analysis. Next slide, please. To better understand patient perspectives about equitable healthcare, the research took a two-phase approach. First, quantitative and qualitative data was gathered through a short 10-minute, 14-question survey. The survey was divided into three thematic themes: provider factors, environmental factors, and overall patient experience and need. The Patient Insight Institute recruited a diverse pool of insured patients served by the foundation. Patients recruited represented various medical diagnoses and were individuals who were lower income, racially and ethnically reflective of the United States population, and experienced some level of healthcare access and/or affordability challenges. Surveys were disseminated via email from June through July 2023, and participants received an initial email invitation and up to 3 reminder emails. A total of 1,323 patients completed the survey in full at the end of the recruitment period. Next slide, please. All patient participants had a chronic or complex illness and a history of access or affordability challenges. Additionally, 28% of respondents identified as non-white, 56% were female, 30% were 18 to 55 years old, 35% identified as being part of the LGBTQIA+ community, 65% were Medicare insured, 19% lived in a rural location, and 56% reported an income less than $48,000. Next slide, please. So here are some of our findings. Patients explored various options about factors they consider when selecting a healthcare provider, such as racial and cultural concordance with the provider or staff, provider experience and knowledge, location and hours, online reviews, competency training, reports of discrimination, non-clinical assistance, ability to access complementary medicine, and respect. Non-white patients were likely to prefer a provider of the same race and ethnicity, while Hispanic white populations had a higher preference for someone of the same gender. LGBTQIA+ individuals preferred a provider who was also part of their community. In the open text response regarding provider factors, patients also expressed their desire for a provider who possessed high levels of soft skills. Next slide, please. When asked to agree or disagree with a set of statements, patients prioritized providers who had experience with, quote, patients like me, end quote, or those who were recommended by their current medical provider. Next slide. And next slide. Thank you. The next set of questions ask patients about important factors related to the physical and virtual environment in which they receive care. When asked about accessing care, respondents emphasized the importance of telehealth, care close to their home, travel convenience, and extended hours of service. Receiving financial counseling was also an important factor in an office feature. Patients were also asked about factors related to community and cultural identity and how that impacts a physical or digital office environment. Privacy and handicap or physical access were important features about a provider's physical environment, as were staff diversity and patient diversity. The open-ended response revealed a strong desire for a provider's office environment to include positive staff engagement through communication and bedside manner. Next slide, please. The final set of questions asked patients about their needs and overall experiences during their healthcare journey. Communication style, specialized medical skills, and experience were seen as important indicators of high quality and respectful care. Interactions with healthcare staff were main drivers of negative experiences, including a lack of training and overworked or stressed staff. Next slide, please. Patients reported factors of, can we go back a slide? Sorry. Patients also reported factors of identity such as race and ethnicity, insurance status, English language capability, gender identity, sexual orientation, health conditions, income status, appearance, and immigration status as drivers behind negative experiences. When asked about solutions for improving negative healthcare experiences, patients highlighted improving provider soft skills. Finally, patients were asked how they prefer to access information about their healthcare provider or location. Generally, patients reported finding information about a provider through word of mouth, though patients would rather find this information online via websites and physician review sites. Next slide, please. The second phase of the research included a qualitative component to delve in deeper to some of the findings from the survey, such as to what extent have patients experienced concordant care? Is racial concordance a reliable indicator of better interpersonal skills? And how do patients prefer to learn information about their providers? The Patient Insight Institute conducted 3 90-minute focus groups. Primary recruitment for those focus groups included those who identified as Hispanic or non-white, and those who did not select, I prefer a provider that has the same race and ethnicity as I do on the survey. 12 registered for each focus group, with final attendance being 10 for focus group 1, 9 for focus group 2, and 7 for focus group 3. Next slide, please. Six major themes about care concordance were identified following the focus group sessions. Patients don't seek concordant care. Patients can't find concordant care in rural areas. Patients look at credentials or bedside manner. There are challenges within the bigger system. The notion of culture is unique and individualized, and patients feel they must be their own advocates. Next slide, please. We found that racially concordant care often just happens rather than patients actively seeking it out. Patients didn't tend to have a negative or positive view on concordant care, and they were happy if it happened. Smaller populations noted an avoidance towards concordant care to keep a sense of anonymity in the community. Next slide, please. And even if desired, concordant care may not be sought out due to geographic limitations and limited providers in rural areas. This was also coupled with a desire for privacy. Next slide. Patients place precedence in looking at a doctor's credentials and bedside manner before looking at a doctor's racial demographics. Next slide, please. Another theme was that patients described challenges with the overall healthcare system, and that included who an individual can see as a provider. Navigating insurance was one of those challenges that was brought up in the bigger healthcare system. Next slide, please. Patients also noted that culture is unique to each individual, and cultural competence in a provider can vary from patient to patient. Patients noted the importance of being viewed as whole individuals encompassing their whole culture versus focusing on just specific aspects of their culture. Next slide. Patients also noted that no matter who their doctor is, they felt they must be their own advocate to ensure their best overall health outcomes and well-being. Next slide, please. 5 major themes were identified related to accessing information: word of mouth, online ratings, importance of patient portals, location, and communication. Next slide, please. Patients often gain information about providers through word of mouth, such as speaking with friends or family, community support groups, and primary care providers. Next slide, please. We also found that patients utilize platforms such as insurance portals, patient portals, and various websites to assess doctor reviews and online ratings. Next slide, please. Patients utilize their patient portals for communication, scheduling appointments, and searching for doctors. Patients have a desire for a universal patient portal across providers and specialists to streamline communication with their healthcare team. Next slide, please. We also found that the location of healthcare providers is important to patients. Insurance often limits provider options, leaving patients to question the number and proximity of available doctors in their area. Next slide, please. Patients desire input regarding patient-provider communication, specifically around care coordination and direct communication with their doctors. This was incredibly important during times of serious illness or disease that require prompt decisions. Next slide, please. Our findings demonstrate the complex and unique needs and preferences that patients consider regarding providers and the healthcare environment. We found that no single factor is a universal indicator for what patients desire. Racial concordance may be significant for some, while others may prioritize different factors related to their care. Patients strongly emphasize the importance of soft skills and a desire for trust and relationship building with their providers. Word of mouth is a valuable source of information, and patients value learning about their provider through online ratings. These findings provide insight into how to center patient preferences to promote positive, accessible, and equitable care experiences. For example, health insurance providers can maintain or expand available information to patients regarding coverage and providers. Provider profiles can be expanded to include soft skills and experience, and an accessible online rating system can be developed to incorporate patient feedback and experiences. Next slide, please. Thank you so much for your time today, and now I'd like to pass it over to Jamie Trotter.